On the medico-legal significance of antemortem and postmortem wound, describe the naked eye appearance of such a wound. The distinction between antemortem and postmortem injuries and their proper timing is one of the cardinal problems of forensic medicine. It helps not only the conviction of the guilty but also the acquittal of the suspected but informed. For example, a person may after natural death be run over by a car if the medical officer does not recognize that the car injuries are postmortem in nature. An innocent person may be arrested for even found guilty. On the other hand, erroneous observation or interpretation may lead to acquittal of guilty. As for example, the body of a murdered person may be placed on a railway track in order to suicide or accident. If the medical officer does not recognize that the real injuries are postmortem in nature, the guilty person would escape the rigors of law. It is therefore necessary for the medical officer to make detailed observation in such cases. Naked eye appearance of wound, histological timing of wound, histochemical timing of wound, biochemical timing of wound if the facility exists. Naked eye appearance of wound. Sometimes it is possible to determine the nature of wound either antemortem, postmortem, or visual. Naked eye appearance. Wound incurred during life bleed freely. Extensive infiltration of deeper tissues occurs. Edges of the wound may be gapping or inverted, become somewhat swollen, and firmly coagulated blood will be found in and around the wound. Arterial sprouting markers may be seen. In a postmortem wound, bleeding is light from cut veins and there is no infiltration of the tissue. Edges of the wound do not gap or nor they is swollen or little or no coagulated while found in and about the wound. If life has lasted for some time after wounding, distinction between antemortem and postmortem wound is simple. Sign of vital reaction such as inflammation repair will be present in antemortem wound. However, this is not always, and in case of doubt, it is necessary to distinguish antemortem from a postmortem one by a clinic. Additional method of examination: histological, histochemical, and biochemical. Histological timing of wound. Morphology of the various stages of the wound healing. The series of event response to initial injury generally a definite order following various histology of any traumatized person. Supravital period less than 4 hours after injury, no distinct histological signs of inflammation. Histological distinguish between antemortem and postmortem is not possible during this period. Supravital period 4 to 16 hours. At 4 hours, some neutrophil granulates appear perivascularly. At 8 to 12 hours, polymorphonuclear macrophages and activate fibroblasts from a distinct peripheral wound zone. At 12 to 16 hours, granulocyte dominates macrophages in the ratio 5 to 1, 5:1. Imminent necrosis in the central wound zone. Supravital period 16 to 48 hours. 16 to 48 hours, 24 hours. Relative number of macrophages increases. Ratio of polymorphonuclear to macrophages falling to 0.4. At 16 hours, older fibrin stains are red with a maritaceous scarlet blue, whereas before 16 hours, new fibrin stain yellow. 24 hours, the number of granulocyte and amount of fibrin increases to maximum. They remain at this level until 2-3 days. After 24 to 48 hours, epidermis grows from the incisor wound towards the center of the wound. At 32 hours, therefore, after necrosis is apparent in the central wound zone, at 48 hours, macrophages reach their maximum concentration in the peripheral zone. Supravital period 2 to 4 days. At 2 to 4 days, fibroblasts migrate to nearby connective tissue to the wound periphery. At 4 to 5 days, epithelialization of small wound and abrasion is complete. Therefore, the regenerate epidermis become highly stratified, find thicker than the normal surrounding epidermis. At 3 to 4 days, capillary buds appear. Supravital period 4 to 8 days. At 4 days, the first new collagen fibers are seen. At 4 to 5 days, there is profuse ingrowth of new capillaries. Capillaries continue to proliferate until their 8th day. At 5 to 7 days, epidermal thickness decreased to nearly normal in the epithelialized small wound. At 6 days, lymphocytes reach their maximum concentration in the wound periphery. Supravital period 8 to 12 days. At 8 to 12 days, there is decrease in number of leukocyte, fibroblasts, and capillaries. There is increase in number and size of the collagen fibers. Supravital period over 12 days. Over 12 days, there is definite regression of cellular activity in both epidermis and dermis. Vascularity of the dermis diminishes. Collagen fibers are restored. Epithelium shows a stainable basement membrane. At 14 days, fibroplasia reaches its peak. Therefore, they occur in gradual shrinkage and maturation of the connective tissue in the wound. Histochemical timing of wound. Histological investigation greatly contribute to the estimation of the age of injuries and an essential part of timing of this is, however, the disadvantage is that no definite leukocyte zone is visible until 8 to 12 hours after injury. This latent phase is far too long since most cases of forensic interest Survival time is shorter than 8 to 12 hours after wounding. It is therefore necessary that histological investigation should be completed by enzyme histochemical examination of the wound when required. Histochemical method involves the study of enzymes in the wound region. Enzymes studied are adenosine triphosphatase, aminopeptidase, acid phosphatase, adenosine triphosphatase, alkaline phosphatase, aminopeptidase, acid phosphatase, adenosine triphosphatase. The antemortem wound, two distinct zones of enzymes are activity are seen. 100 to 300 micrometer deep peripheral wound zone shows increase in enzyme activity beginning as little as 8 hours after injury, probably indicating repair. Such increase in the peripheral wound zone is called a positive vital reaction. The most and immediate vicinity of the wound is 200 to 500 micrometer deep central zone exhibit a progressive loss of enzyme activity, probably indicating imminent necrosis. The regressive phenomenon is called a negative vital reaction. It demonstrable as a diminishing stainability and becomes visible 1 to 4 hours after wounding. The activity of the adenosine triphosphatase esterase in the peripheral wound zone increases as early as 1 hour after injury, that of aminopeptidase at 2 hours, of acid phosphatase at 4 hours, and alkaline phosphatase 8 hours. Acid phosphatase, alkaline phosphatase, aminopeptidase. The consecutive appearances of enzyme demonstrable by various methods of enzyme histochemistry allows the construction of a biological timing table, which is useful in the approximate timing of the antemortem wound to distinguish between antemortem and postmortem wound. The following case illustrates the practice use of the enzyme. A jealous man believed that he had killed his fiancée when he hit her head with a stone. He carried the body to a fenced railway track to simulate a suicide. 2 hours later, a train arrived. Was a fatal injury. A medico-legal autopsy was performed in the wound, examined histologically. In a laceration on the head, the activity of the enzyme adenosine phosphatase esterase aminopeptidase was increased. By contrast, there was no increase in the activity of acid alkaline phosphatase. The results indicated that laceration on the head was produced only 2 hours before the final fatal wound caused by the train. The girl had obviously been unconscious after the initial head injury. When the police confirmed the man with this fact, a confession of the sequence of events was forthcoming. The man was convicted. A man died of heart attack while walking on the road. His dead body was subsequently run over by a car. The course of events was reconstructed by histological and biological study of the injuries, and it is established that the injuries were postmortem in nature. It is important that practice that the histochemical vital reaction is recognizable several up to 5 days after death. There is no increase in enzyme activity in the periphery of the postmortem wound. There are certain exceptions in the biological timetable when it is applied to human autopsy material. Conditions such as advanced senility, cachexia, and very severe multiple injury may impair the local reaction of the wound skin. Enzymatic response to injury is quantifiably influenced by factors such as severe blood loss and coldness. However, the increase in the activity of the various enzymes. Brain injury not immediately fatal. A male aged 60 was alleged to have been beaten with an axe on the left frontal region. In operation, there was a depressor fracture of the skull in the left frontoparietal region. Broken fragment of the skull and blood clot were removed from the brain. The liquefied portion of the brain was evacuated and irrigated. A large cavity is seen in the frontoparietal region. Patient expired 11 days after the injury. Wound edge, central zone, peripheral zone. Epidermis, dermis. Wound edge, central zone, peripheral zone. Schematic diagram showing the enzyme zones demonstrated by an enzyme histochemistry of an antemortem wound. The two distinct zones of enzyme activity are seen. The immediate vicinity of the wound edge, central or superficial zone, 200 to 500 micro deep shows a decreasing enzyme activity surrounding the central area. Peripheral zone, 100 to 300 micrometer deep exit increase in enzyme activity. These changes are demonstrated early as 1 hour after wounding in the antemortem injuries only. The schematic diagram showing the histochemical estimation of the age of the antemortem wound. 0 to hours alkaline phosphate, ATPases, esterases, aminopeptidases, 2 to 4 acid phosphatase, alkaline phosphatase, polymorphonuclease, mononuclease. Comparison of the relative serotonin and histamine content in the wound inflicted at different types of periods. Appear according to the general biological timetable in the spite of the presence of this endogenous and exogenous factor. Method of enzyme histochemistry permit the recognition of the tissue reaction to an injury at early phase that is possible by the standard technique of classical histology. In practice, method of enzyme histochemistry acts as a guide to the approximate age of wound, especially those inflicted 1 to 8 hours before death. Histochemical methods are thus useful as supplement to the histological study, which is still indispensable to evaluate the timing of wound for forensic purposes. Biochemical timing of wound. Although enzyme histochemistry has shortened the latent period to about 1 hour, it still leaves that every last hour before death a challenge for the further study. As we know that the first period of inflammation, vascular response is dominated by vasoactive substance including histamine and serotonin. Biochemical timing of wound depends upon the measurement of the histamine and serotonin content of the injured skin. These are compared to the histamine and serotonin contents of the control sample removed from neighboring intact skin of the same person. This is necessary. There are great individual and regional difference in the context of these amines. On the basis of the extensive autopsy study, there is increase in serotonin content of the injured tissue, but must be at least 2-fold, and then in histamine content 1.5-fold or more as compared to the respective content of the control sample to indicate that the wound was inflicted before death. There is no increase in serotonin in histamine context in wound inflicted after death. Results of the biochemical serotonin and histamine determinants have been compared with each other. In the wound inflicted immediately before death, there is usually greatly increase in serotonin content and often a slight decrease in free histamine content. In a wound inflicted 5 to 15 minutes before death, there is a relatively higher increase in histamine than serotonin, while wound inflicted 15 to 16 minutes before death, the reverse is true. Several cases of road traffic accident have been incurred where it has been possible to show that driver was dead before the crash. In these cases, there have been signs of coronary artery disease and cause of death has been obviously natural. There were no changes in the relative serotonin histamine content of the often severe wound caused by the crash. This is unsustainable as the wounds were caused after death. The following cases illustrate the practical use of the histochemical in the naked body of a young woman was found in a storage cellar. No signs of violence were found on external examination. Sperms were found in her vagina. Autopsy organs were cyanotic and congested. Blood in the heart was dark and fluid. Such hemorrhages were found in the lungs, pericardium, pleura and larynx. In addition to the signs of asphyxia, there will be no visible mark on the skin and no injuries to the deeper structures of the neck. Skin samples were excised and from the front of the neck, serotonin content was 2-fold and the histamine content about 1.5-fold as compared to those of the control sample taken from the subclavicular vein. These were the biochemical signs of violence in the front part of the neck. In view of the general signs of asphyxia found at autopsy, suspicion of a throttling manual strangulation was confirmed. The police confronted the owner of the cellar with an accused that he had raped and throttled the woman. The man broken down and confessed that he had indeed compelled by the woman by threats of killing her to have intercourse with him, and to prevent her screaming, he had pressed his hands on the front of the neck and she suddenly ceased to breathe. To conclude, a more accurate timing of wound is now applicable. Distinguish between antemortem and postmortem used by a histochemical serotonin and histamine method after a survival time as little as few seconds. The method of enzyme histochemistry acts as a supplementary guide to the timing of the wound, especially in those of 1 to 8 hours before death. If a wound has been inflicted 8 hours or more before death, it may be timed histologically. The histological study is still an essential part of the timing of wound. In addition to histology and enzyme histochemistry, biochemical determination of serotonin and histamine are also applicable to forensic autopsy material. Thank you.